Hey there, welcome to our channel, where we dive into all things baby care. Today, we're tackling a topic that might seem simple but is crucial for your little one's health and development: formula storage and preparation. First things first, let's talk about the different types of baby formula. You've got your powdered formula, which is the most common and affordable option. It comes with a pre-measured scoop, making mixing a breeze. Then there's concentrated formula, which is liquid but needs to be mixed with equal parts water. Lastly, ready-to-use formula is the priciest but most convenient, as it's ready to go right out of the container. Now, you might be wondering, does it matter which formula I choose? The good news is that the FDA heavily regulates all commercial infant formulas to meet safety and nutritional standards. However, if your baby has specific dietary needs, your pediatrician may recommend a special formula. So, how do you know if your baby isn't vibing with their formula? Some signs to watch out for include blood or mucus in their poop, diarrhea, gas pain, slow weight gain, and vomiting. If you notice any of these, don't hesitate to reach out to your doctor. Switching formulas can be a gradual process, and it may take your baby a few days to adjust. To make the transition smoother, try mixing the old and new formulas together, gradually increasing the ratio of the new formula over a few days. For example, if your baby is drinking 4-ounce bottles, mix 4 ounces of water with 1 scoop of the old formula and 1 scoop of the new formula for 3 days. On day 4, serve a bottle made entirely of the new formula. If your baby is drinking 6-ounce bottles, mix 6 ounces of water with 2 scoops of the old formula and 1 scoop of the new formula for 2 days. On day 3, mix 6 ounces of water with 1 scoop of old formula and 2 scoops of new formula. Finally, on day 4, serve a bottle made entirely of the new formula. During this transition, your little one may experience more burping, gas, and changes in poop color, all totally normal. Just keep an eye out for any signs of intolerance we mentioned earlier. Now, let's talk about storage. Always store unopened cans of powdered and concentrated formula in a cool, dry place. That means no refrigerator or hot car. When it's time to open a new can, choose the one closest to its expiration date. Once opened, powdered formula is typically good for about a month, while concentrated and ready-to-use formulas should be refrigerated and used within 48 hours. When it comes to preparing formulas, timing is key. Use it within 2 hours of preparation, or within 1 hour from the start of feeding. If your baby doesn't finish the bottle, it's best to discard the leftovers to avoid bacterial growth. If you need to prepare formulas ahead of time, you can safely store it in the fridge for up to 24 hours for powdered formulas and 48 hours for concentrated and ready-to-use formulas. Before you start mixing, make sure your hands and all feeding equipment are squeaky clean. Follow the instructions on the formula can, using the provided scoop and the recommended water-to-formula ratio. Tap water is generally safe to use, unless there's a known contamination issue in your area. If your baby is premature or has a weakened immune system, check with your pediatrician about any extra precautions, like boiling the water before mixing. Speaking of water, let's talk about how much you need. A standard powdered formula recipe calls for 2 ounces of water for every 1 scoop of formula. So, to prepare a 4-ounce bottle, you'd add 4 ounces of water and mix in 2 level scoops of formula. Always measure the water first, then add the powder. Concentrated formula, on the other hand, must be mixed with water at a 1-to-1 ratio. So, for a 4-ounce bottle, you'd blend 2 ounces of formula with 2 ounces of water. And remember, ready-to-use formula is just that, ready to use, no mixing required. Now, I know some of you might be wondering about making your own formula at home. While it might seem like a cost-effective or more natural option, the FDA strongly advises against it. Homemade formulas lack the necessary safeguards and may not contain the proper nutrients for your baby's growth and development. In fact, babies fed DIY formulas have been hospitalized for low calcium levels, contamination, and other inadequacies. Trust us, it's not worth the risk. Thanks for tuning in, and be sure to like, subscribe, and hit that notification bell for more baby care tips and tricks. If you found this video helpful, share it with your fellow parents and caregivers.